Okay, so I'm doing new patient exams this afternoon, and Susanna has just come in for a consultation. Susanna's 8, right? And the history from Mum is that she had a sleep study when she was younger.
Correct.
And then had her tonsils and adenoids removed.
That's right.
Which improved the sleep but didn't totally correct the OSA. So Mum has gone back and had a second sleep study, and the second sleep study still shows there's some mild apnea, right? So what do we do in a situation like this? And this is my passion because my education background in orthodontics, in dentofacial orthopedics, and in dental sleep medicine, I think allows me to look at it more holistically. So then the respiratory physician has asked Mum to use Nasonex to try and improve the nasal airflow. And then finally suggested maybe some oral myology, okay? But if you look at the occlusion, just bite together again, you can really see where the problem lies. That's a very big class 2 jaw pattern. Now, if you look at the upper jaw, look how narrow that is, possibly as a result of nasal obstruction issues in the past. So my view is, when the obvious problem is orthodontic, maybe we should consider widening the upper jaw to help improve nasal breathing, and then advancing the lower jaw so that we can open up the airway. Now, can you open really wide and say ah? So we're looking at the, open again. So just say ah. Look at the Mallampati index there, right? And just close together again. And we want to get that tongue definitely in the right position. But how can oral myology be successful if there's no room for the tongue? Open again for me. And that's what we're discussing here. So the treatment options, possibly after we take records, may be to widen this young lady's palate so it's easier for her tongue to elevate. I find that might help the nasal breathing, but if it's related to allergies, Mum said we've tried Nasonex, I believe,
yeah.
And children obviously give up after that. There's newer methods to treat allergies which are more long-term. So we want to look at it holistically. Yes, we want to improve the allergic rhinitis. B, we want to change the structure of the jaw. And C, we want the tongue in the right position. So if you look at the latest research, and I particularly will quote Dr. Maria Villa, who's from Rome, her protocol is like this. Ear, nose and throat doctor first, orthopedic expansion, mandibular translation, if need be, second, but thirdly, oral myology, right? So I think if you can get a child to breathe through the nose, you make the jaw the right size, and then you get the tongue in the right position, all of those things are going to help this young lady to really, hopefully, have a residual OSA back to normal. What we don't want to do in a young child like this, unless it's really, really severe apnea, is to put on a CPAP. A CPAP machine, which is very effective in adults, is also effective in children short term, but long term, that is going to affect forward growth of the upper jaw, which is what we don't want. So the golden treatment is think about orthopedic development to improve airway rather than anything that's going to be retractive in nature. Okay? Thank you very much for being the patient today.